All this is Dr. Mobeen Sayed from drbeen.com. Welcome to the second show for today. Uh, so we have a lot of discussion in various articles, in various studies, some showing Israel's data one way, let's say vaccines are failing, some showing the Israel's data as vaccines are working. And as usual, what I want to do is look at that data together to see what are we seeing there, and then you can form your own opinion. You can maybe go away and say, I think it is not working, the vaccines, or you might go away and say, yeah, my takeaway is that these are working. So this is the discussion for today. Let's start. So here is drbeen.com. This is the links. These are the links here. So this is Worldometer, world. Here is an article. So I wanted to look at this discussion today in the backdrop of these articles. So here, for example, highly vaccinated Israel is seeing a dramatic surge in new COVID cases. Here is why. And they have given a bunch of reasons. I would let you read it there. I'll probably scroll through a couple of those reasons that are interesting. Then there is from Reuters, Israeli doctors find severe COVID-19 breakthrough cases, mostly in older, sicker patients. This is Worldometer with Israel itself. And if you see here, the latest surge, 9,666, highest 7 days rolling average, is actually higher than the previous surge. So if I go in here, 9,580. And so the infection rate is very high, just like vaccination rate is very high as well. So if you see here, this is the number of deaths. So we'll look into that as well. So these are the backdrops. Here is the dashboard from Israel. I have done the Google translate on it from Hebrew to English. So of course, there may be some words that may not fit the normal English terms that we speak, but still, it is a very useful dashboard, number one. Number two, this allows you to look at data by yourself. Instead of saying this rumor said this or this article said that, you can actually see the data here. And I was already looking at the data and I was thinking some articles picked up what they felt would serve their talk or their position, or whatever is the point of that article. And some articles picked up the entirely different data set. But the data set is coming from here. So it is interesting to look at this. Then I want to discuss an entirely different thing, still related to Israel, a study. And David, my friend here, he had sent this over to me. This is a study of the side effects by the vaccines and various kinds of side effects. And the interesting comparison is that if somebody gets COVID, then what is the risk of that specific side effect, versus if somebody has a vaccine, then what is the risk of the side effect maybe because of the vaccine. So that is interesting. Another interesting news is, so this is, I hope I can pronounce his name correctly. He is Drbeen. He is an assistant professor in Technion, Israel. He's a biomedical data science lab, or he works in there. Beautiful. Some of his data processing is beautiful, so we'll look into that. And finally here, Herpes Zoster or shingles. So these are the links. Let's very quickly now go over the data itself, and then we'll look at some of the, actually, let's look at the article for a second. This is NPR. The article here is saying that there is dramatic surge. And so if you see here, it's probably one of the infection rate is very high and the vaccination rate is very high. And they're trying to answer the question, why is that? So for example, immunity from the vaccine dips over time, Delta variant broke through, and so on. I don't want to take this is their copyrighted material, but there is a couple of things that are interesting. Looming question, will we need COVID-19 vaccines every several months? This is the discussion we had a few days ago as well. Are we going to have a booster every 6 months? And it may be that in some cases there's going to be booster every 6 months. Again, not my comment. This is something that is very interesting, that folks in the comment just start attacking me to say, so then how do you explain this? Well, this is the data here. Do they finally decide with the data to say, now we're going to give a booster or not give a booster? They look at the vaccine side effect and say, should we do the vaccination or not? That's a different discussion. I am not in control of that. However, looking at data together to form our opinions is a wise adult thing to do. So here, looming questions. Will we need COVID-19 vaccines every several months? We don't know. That is actually the right answer. And then they have for a Iti Ben Yaakov, and she said, she predicts that coronavirus, like the flu, will mean shots every year. We will have to live with the corona, she said. So this is one of the doctor's point of view. Then I'm going to go here. This is Reuters. And there are a couple of interesting statements here in this article that I think are an interesting backdrop, because from these statements, then there is some folks will further convert them into rumors and some will take them as such. And I would suspect that when a media outlet presents something, there is a slight bias in there as well to kind of make it a little more sensationalized. But still, there has to be some data underneath. So here they're saying around half of the country's 600 patients presently hospitalized with severe illness have received 2 doses of the Pfizer shot, a rare occurrence out of 5.4 million fully vaccinated people. So interpret that. Your interpretation may be different. Mine may be different, but I think what they're saying here is, and at the risk of providing one interpretation, and that is that more than half of Israel is vaccinated fully. And then in all the severely ill COVID patient, half of them are vaccinated. However, so this creates a picture in your mind, correct? However, when you go to the bottom of this article, they kind of provide another perspective on it. And they say, disease experts say it's not clear how representative the figures are, but agree it is concerning given evidence that overall vaccine protection against infection is waning. And then they say they cannot say whether that is due to the amount of time that has passed since inoculation, that means waning, the ability of the highly contagious Delta variant to break through them, maybe that is the case, or it may be the age and the comorbidities of some people who are vaccinated, or maybe a combination of all of them. It is interesting for me. I actually like it that they put that together. When I read here at the top, I thought that they would actually just keep this bias or leaning to say that, hey, vaccines are not working. But near the end, they balanced it out as well by saying it may be Delta, it may be vaccines, it may be comorbidities, it may be age, it may be time since vaccination, and so on. Now, with this backdrop, we have some thought in our head. So let's look at data here. So starting with this is the page. There is a summary at the top. What I am interested in, and we went over this page a few days ago as well. This is, of course, today's data. What I'm interested in, number one, daily verified and immunization, that is fine. This is interesting for me, severely ill. Severely ill. And here, once again, check this one out. I have the cursor on the right side. It is 8/25/21, so maybe a day ago. Unvaccinated and infected, severely infected, 265. Partially vaccinated, 1 dose, or 2 doses but not yet reached the full vaccination time, 2 weeks after the second dose, 58 people. And then I want to make sure that it is absolute numbers and not the rate. And then finally, fully vaccinated, 19. So think about the article before, 600 acutely ill patients in the hospital. So that means that if you continue to go backwards and keep accumulating some of those patients in the hospital, you would get a total of 600. And then if you keep adding all of them, they're saying here by now half of them are vaccinated and half of them are not vaccinated. So to me, it is interesting to actually do this analysis. I don't have that. I didn't do this sum for daily, but they have a data point down here. I'm going to go here for a second. Here, I think this is the one. No, sorry, not that. This is the one. Severe number of patients. So I think this is the daily total. So here, for example, 693 patients in hospital, I would say, severely ill. However, in this chart, they do not have a breakdown of saying who is vaccinated and who is not. So eventually, either we have to go back here and sum them. And the problem with that sum is the following. Let's say if we are here and we are just adding them, what we do not know is that how many of these patients may have passed away, how many of them, let's say from the blue unvaccinated side, are still in the hospital, and from the others. So anyways, to me, it seems here are the questions in my head. Number one, why is it that here, this is the August, this month, or go back a couple of days, let's say this month's beginning, the rate was almost similar, 46, 25, 10, not 100% the same, but if you get the vaccinated both and then unvaccinated, sort of same. Otherwise, 10 versus 46, 4 times different. And then if you arrive here, this is 265 and 20. So it is not 4 times anymore. It is almost 10, 11, 12, 13 times the difference. So if you see here, 265 and 19, similar difference. Here, 243 and 20, 12 times the difference. So that difference is increasing. So this is actually concerning. For me, my interpretation, once again, you can say, hey, I'm wrong, or your interpretation may be different, or your knowledge, the data may be different. Here, my interpretation is that unvaccinated folks are more rapidly now becoming severely ill compared to vaccinated. So this is one data point, and I wanted to look at this one. Then active patients. So this is the rate per 100,000. So if you take 100,000 folks who are vaccinated, another 100,000 who are not vaccinated, and then see what is the rate of the disease in them. If you see here, 90%, 90 plus age, fully vaccinated folks, 47 per 100,000, and unvaccinated folks, 573 per 100,000. So that again is about 11, 12 times the rate. And if you go to the lower ages, so let's say here 80, 366, and what was the other number? 41. So similarly, about 10, 9 times. More 70 to 79, 16 and 382. This is more. This is actually 160 and 160, almost 20 times the difference. Here, 135 and 11. So 12, 13 times as we saw. So this was an outlier. Here is another 4 and 58. That is the age 50 to 59. So 4 and 58, about 13 times. 1.4 and 39. This is again in 40 to 49 years of age. This rate is very high in unvaccinated. And that may be because they are going out, they're younger, they think they would have less of an effect and so on. So 1.4 and 39. And I'm actually surprised that Israel still, at least from the data, from the articles here, about 50 to 60% vaccinated fully. Then here, 30 to 39, 0.4 versus 12.3. So if you go about 12, and then 12, and another 12. Almost 30 times the difference. 20 to 29, 0.1 versus 5.4. So you can do the math here as well. So this is the rate of the disease in vaccinated versus unvaccinated. Again, this is the data here. I may be making a mistake to interpret that. That is fine. I can, you can point it out. I can fix it. But this is the data in front of us, and the link is in the description. The other thing that I really want to make sure that we can look at, and that is the R naught. We know that the R, and let's look at this for a second. We did this review a few days ago as well, and this is the 1 dose, 2 dose, 3 dose of the vaccine. So if you see here in 90 plus, 94.2%, 90 plus have at least 1 dose. 90.6% have 2 doses, and then 69.9% have 3 doses or a booster as well. Now, with this backdrop, keeping in mind the booster, so the question would be, is booster helping? And here, I'm going to go to Devir Aran's tweet here, and here is his data that he has picked up. And it will be interesting to ask him, what is your source? I believe it should be the same source as I was looking at. Here, unvaccinated, this orange line. Vaccinated, green, 60 plus. Vaccinated, this bluish, 60 minus. And then vaccinated 60 plus with purple. I think one important thing to note here is that the purple is 3 doses. And if you look at this chart, what it is representing is R naught, or reproduction number. And what we say is that if R naught is 1, that means one person is transmitting the disease to another one person. So we call it a stable disease in the society. It is just going from one to another without spreading. And if R naught starts going below 1, that means the disease is reducing. And if R naught starts going above 1, that means disease is continuing or spreading. So if you see here, in folks with 3 doses, R naught has almost plummeted down to below 1 or even 0.2. If I could extrapolate over here, maybe 0.5-ish. So that means a lot of reduction in spread, no spread, because it is below 1. However, other age groups and other vaccine doses, they are, for example, unvaccinated 60 minus. I probably just said 60 plus last time. Unvaccinated 60 minus, below 60, unvaccinated, this orange. Look at the R naught. R naught is hovering about 1.3. So that means it is spreading, slowly but spreading. Unvaccinated 60 plus, the green ones, their R naught was high as well in the beginning. And now look at this, their R naught has dropped, but still higher. That means this group, unvaccinated 60 plus, becoming sick, may actually have deaths as well. And then if you look at vaccinated 60, below 60, and with not fully or with 3 doses, their R naught is high as well. So there is only one group whose R naught has gone down. Now, let's think about this once more, that is it the 3rd dose? Is it the revving up of the immune system for some time? I think it is the revving up of the immune system, which is caused by the 3rd dose. And that is protecting the persons who are in active immune state. And this is what you're seeing in this purple line. It will be interesting to see that after, let's say, 6 months, when the immune system has gone down to a more dormant or rested state. I won't call it dormant, more resting state, and then see what is happening here. But this is interesting analysis. Now, if I go back here and look at the R naught, there is R naught here on this table as well. So this is R equals 1, R is greater than 1, epidemic in spread, R equals 1 in stable state. So if you see here, this is 726. about a month ago, and that is 1.34. And that means infection was still spreading, much lower than many other places. And as you can see, it is continuing to reduce in its spread. So for example, on 8/14, the coefficient or R production R naught is 1.14. So that is cumulative. It is still spreading, but lower compared to many other societies or many age groups or vaccinated groups, or I would say comorbidity groups, and so on. So this is accumulated R naught. Very interesting for me to see from here all the way to 1.4 at this time, 1.14, sorry. Then another graph chart that I had missed last time when we talked, that was the number of deaths. So here we had seen this chart, severe number of patients. I believe this is the total number of patients. And then if I go down, recover and die. So here, died daily. So average deaths for the time period shown. So for this 1 month, the average deaths are 15 or 16. And daily, for example, on 25th, 14. There may be more data coming in there, unfortunately, here 25, and so on. So you can see actually that within this month, the number of deaths have actually increased. And it has gone up. Let's say it used to be below 10, below 16, and now many times it is above 16. So that is the number of deaths. Now I want to look at this study. So this is about the data and data dashboard. My request to you will be to look at that dashboard by yourself. Make up your own opinion. Look at various articles. Some people are saying, hey, this is a terrible situation. Some are saying, hey, there is some important things to see. For example, severe cases or hospitalizations or number of deaths in vaccinated. Now, here is another study. Let me show you the study's background first. I didn't have enough time to actually draw it out. So I'm going to show you here. The study is from Israel. And here is what they're saying. We use data from the largest healthcare organization in Israel to evaluate the safety of the BioNTech mRNA vaccine. So that is Pfizer vaccine. Pfizer is the platform and BioNTech is the vaccine. Results. So I want to show you the results in that chart. Of course, there's a big study and you can look at the remaining data. Here's what is interesting about this chart. So look at the right side first. Point estimates of the risk difference. So this is a difference of some side effects with the vaccine compared to the same side effects if somebody got COVID. So it is disease versus vaccine related side effects. Point estimates of the risk differences for selected adverse events are shown. Estimates were derived 42 days after vaccination or SARS-CoV-2 infection. So 42 days after the infection or 42 days after the vaccination. Risk differences are shown per 100,000 persons and rounded to the nearest integer. Negative differences or reduced risk are represented as negative values on the y-axis. So now let's look at this. This bluish thing is the risk difference per 100,000 persons who received the vaccine. And then the orange is the risk difference per 100,000 people who are infected. So with this, let's start from here, from the left side. Very first one is acute kidney injury. So administering the vaccine, if the question in your head is, for example, that, hey, if somebody gets the vaccine, do they have a chance of kidney damage? And then if you look at the study, they added a comparative question as well to say, if somebody got COVID, will they have kidney damage and what is their difference compared to each other? And then what is the rate in 100,000 people? So here you can see if somebody gets COVID, if 100,000 people you take, and then 125 get acute kidney injury in 100,000 patients of COVID versus 100,000, let's say, vaccinated people, the risk actually reduces by -5. Appendicitis slightly increased in vaccinated, so 5 versus 4. Arrhythmias more in the COVID versus the vaccinated. Vaccinated actually reducing the arrhythmias. Deep vein thrombosis. Again, this is Pfizer vaccine they're talking about. 43 is the number out of 100,000 on the infection side, and -1, reduced by 1 on the vaccinated side for 100,000. Herpes zoster infection. This is interesting. Look at this. Vaccinated individuals. This is a very common question as well, that, hey, is it possible that shingles could be reactivated? So here, if you see per 100,000 vaccinated, there is 16 increased risk. Number is 16. And in people who got COVID, the risk of herpes zoster reactivation is actually reduced, -9. Intracranial hemorrhage. Vaccinated, reduced risk per 100,000 by 3, and then COVID patient, increased risk. This is interesting. Lymphadenopathy, swollen lymph nodes in the 100,000 per 100,000. Once again, vaccinated, look at the risk increase. What that means is after vaccination, lymph nodes may be swollen. My own family member, one of them, they still have after 4 months swollen lymph nodes, and now their doctor referred them to go to ENT to get those checked. Compared to COVID, which is 3. Myocardial infarction. This is another one. There is an increased risk of myocardial infarction. We know that. So that is here. 25 with the infection and 1 with the vaccine. Again, 100,000 is the number. Myocarditis. Myocardial infarction is heart attack. Myocarditis is the inflammation of the cardiac tissue. So once again, increased risk as well with the vaccine. With COVID, 11, with vaccine 3, but yes, increased risk. Pericarditis, so another cardiac condition with the covering of the heart, that becomes inflamed. And with COVID, the number is 11. With vaccine, the number is 1. But again, this is positive side, meaning there is risk. Pulmonary embolism with COVID, 62 risk, and with vaccine, -1. So what is my takeaway from this one? My takeaway is look at these bars where they are above and then compare them to COVID as well. So first, look at them individually, the blue bars that are above. So if I look at it this way, appendicitis, herpes zoster, lymphadenopathy, myocardial infarction, myocarditis, pericarditis, they have a risk with the vaccine. Then when I compare that with COVID, there is larger risks with COVID except lymphadenopathy. That is this part. And then many other conditions that COVID could trigger actually have a reduced risk with vaccine. So that is how to look at this table. So this is this discussion. Let me now, and if you wanted to look at what is herpes zoster and shingles, you could do that as well. So that is the discussion for today. I wanted to make sure that we can look at this data together, and I hope after the talk, you can go and look at those links and look at that data as well. So please like, subscribe, and share. And if you like this work, support it if you would like to. And there are links in the description with which you can support this. So today we have 2 talks. So I'm going to skip the chit chat. We'll see each other tomorrow at 6 o'clock. Thank you and have a good day. Bye-bye.